experts that are going to be presenting some information for us. And at the end, we're going to have a conversation that is open to the public. So please feel free to send in your questions. Feel free to type them in English or Creole, and we will address them in our conversation part of tonight. So bonsoir tout le monde. Merci d'être avec nous pour deuxième partie de conversation sur COVID là. Après, moun yo fin présenter information, nous va une conversation, so nous met chat question nous gagne, n'importe comment nous besoin faire, y a share avec nous dans conversation partie. So my name is Steffi Milford. I am the community health worker for the Haitian Americans United for Progress, and I work in the Department of Maternal Infant Health, which is addressing maternal infant health issues for moms and babies and people, parents in general. So, no, moi c'est Steffi Milford, moi son travail pour Hope no community health worker, comme community health worker, et puis moi aider maman ti bébé. So let me tell you a little bit about Hope. The Haitian Americans United for Progress was founded by leaders and advocates to resettle and integrate Haitian asylum seekers and immigrants in New York City. 45 years later, Hope is the largest Haitian-led community-based organization in New York City, managing several important and sizable programs from offices in Queens and Brooklyn. Now I'm going to be introducing Senator Leroy Comrie, who would like to start us off with a few words.
Thank you, Steffi. I appreciate Hope continuing to put these series out. And it's very important that we do everything we can to dispel all of the myths and encourage people to take the vaccine so that they can be protected, that we can go back to being alive, doing the things that we are used to doing, having the opportunity for real interactions where you can hug your family and not be afraid of going to talk to your parents or grandparents, and that we can go back to somewhat of a normal life in this new age that we're in. We now have a major vaccination site, which will be starting at York College tomorrow, where they're able to do 3,000 people per day. And people have been signing up, but we need more people to sign up. There are plenty of slots available, and we need to not lose that site because it's important that we keep that site in our community. So your college is there, it's available. You can just go to the website at the New York State.gov and sign up for this, and it's quick and easy to do. I would encourage everyone that, that we have people that created this vaccine that are African American, that are doctors and scientists and chemists that all were from the African American community and have been involved in the development of these vaccines. And they have said that they're safe, and we should believe them. Many people in our community have now taken the vaccine, and they have all been healthy and all are doing well. So I would encourage everyone to take the vaccine. I would encourage everyone to make sure that they're still, even after you take the vaccine, remaining cautious, staying safe, wearing a mask in public, and encouraging young people, especially many of whom are asymptomatic, to wear a mask also, especially when they're around their adults and their relatives. So again, I want to thank Hope for everything that they're doing to continue to make sure that people are informed, that people are aware, and that people will participate in making sure we can get back to a normal state of affairs in New York and throughout the country by making sure that as many people can take the vaccine as possible. Thank you, Hope, for putting on this seminar. I look forward to continuing to work with Hope as they continue to lead the effort in making sure that the Haitian community has the resources, has the services, and gets the information necessary in order to have a good quality of life throughout New York State. Thank you, Stephanie.
Thank you, Senator Leroy Comrie. We are happy that we are able to work with you as well to get to our goal of vaccinating people. So now I'm going to be presenting some information from our Queensborough President, Donovan Richards. He has a few words for us as well. And I'd like to take this moment to remind you all again.
Hope is a wonderful. Hi, I'm Queensborough President Donovan Richards, and I'm truly honored to speak to you today during this COVID-19 community dialogue organized by Haitian Americans United for Progress. HALP is a wonderful organization and has been serving the community for over 40 years by helping individuals and families enhance their quality of life. It is therefore no surprise that HALP is committed to holding community dialogues like this aimed at demystifying the common myths about COVID-19 and the COVID-19 vaccine that exists within the Haitian community. COVID-19 has hit the Haitian community and Black and Brown people in general disproportionately hard. In fact, Black people have died from COVID-19 at about twice the rate of whites. We can attribute this to inequalities in the health system that existed before COVID-19 struck and were exacerbated by the pandemic. My administration is committed to addressing this inequality and to ensure all our communities are treated fairly when it comes to the allocation of healthcare and other resources. In the meantime, we cannot allow the terrible impact that COVID-19 has had on the Black and Brown community to be compounded by a failure to get vaccinated against the disease. The vaccine against COVID-19 is proven to be safe and effective. It is the weapon that is going to win the war against the pandemic. I myself am looking forward to getting vaccinated as soon as I am eligible. But this weapon won't be effective unless enough people are willing to get the vaccine. That's why I'm happy Haitians United for Progress is combating the myths about the vaccine by holding community dialogues like this one. It is this type of outreach that will ultimately turn the tide against vaccine hesitancy and finally allow us to vanquish COVID-19 and get our lives back to normal. So thank you to Haitian Americans United for Progress for holding this community dialogue and for doing so much to support the fight against COVID-19. Together, we will defeat this dreaded disease. Stay safe.
So thank you to Queensborough President Donovan Richard for those kind words. Hope is always happy to help in the effort to vaccinate and support our community. The next person I'm going to introduce is Nurse Florence Mark Charles. She is a registered nurse and a public health nurse. She immigrated from Haiti in 1970 and has been working in health through various positions of leadership, such as administrating and directing different portions of the visiting nurse services of New York. So she is also a board member of the Haitian American Community Coalition, and Florence is going to lead us into the conversation about COVID and what we know about COVID and the thoughts that we have surrounding the pandemic. Florence?
Good evening, everyone. It's a pleasure for me to be with you tonight and dialogue about COVID-19. First, let's define what is COVID-19. COVID-19 is a corona disease caused by SARS-CoV-2. It is transmitted through contact with another person who has the virus. It is a respiratory illness that can affect other organs and has a wide range of reported symptoms ranging from mild to severe illness. Symptoms may appear 2 to 14 days after exposure to the virus. It is a virus that was uncovered in October 2019 in Wuhan, China.
Gen yon maladi nan le monde entier ki rele coronavirus ou bien COVID-19. Li bay problem respiratoire. Sa pou n'kembe nan tèt nou se ki jan pou n'proteje tèt ou ak fami ou. Kontrole santé ou pendant 14 jours si nou te voyaje kite peyi ya. Sou vin développer la fièvre, wap tousse ou bien gen difficulté respirer, rete la kayou pas sorti. Rele docteur sou gen numéro téléphone docteur. Pratike façon hygiénique pour tousse ak pou lave main. Évitez entrer en contact avec moun kap tousse ou bien kap estene. Sou gen nécessité assistance médicale, rele avant. Expliquez docteur ou bien département urgence lan ki jan senti ou. Expliquez yo si ou te voyager. Expliquez ou si ou pense ou te entrer en contact ak yon moun ki peut-être te exposé à virus la. Pour plus d'informations, relais.
Yon nan bagay ki trez important, c'est que nous besoin parler de un paquet informasyon que y a bay nan WhatsApp avec nan Internet sous coronavirus. We have found 7 myths that are circulating in the Internet and WhatsApp. The first one is coronavirus is of human origin and is associated with 666, the mark of the beast. Conspiracy theorists claim that the intention is to insert a microchip into individual to serve as the mark of the beast mentioned in Revelation chapter 13, verses 16 to 18. There is no such evidence. It has been confirmed since January 2021 that COVID-19 originated from bats and was not engineered in laboratory. Let's talk about myth 2. COVID-19 will be deployed to reduce the Black population. Black people, as it was stated before by the previous speaker, the borough president, indicated that it killed twice as many Black as white people. That is why it has been it was been indicated that the Black population should really take the vaccine to protect themselves, as well as seniors, and also people who work in the medical field because they are in contact with sick people who have the virus and are sick with coronavirus. Myth 3. COVID-19 is linked to 5G technology. 5G sends electromagnetic disturbance that weakens the immune system and is responsible for the coronavirus. That is incorrect. Electromagnetic exposure over a long period of time can only be linked to cancer, not to the coronavirus. It is a baseless and biologically impossible, according to scientists. Let's talk about myth 4. COVID-19 vaccine use innovative mRNA-based technology that will change someone's DNA. The first time mechanism involved producing infectious agent directly by the cell and the vaccinated individual. mRNA technology has been around for over 20 years and will not be able to modify your genetic code. The mRNA in COVID-19 vaccine is programmed to generate a specific protein, and it is that protein that causes the body to generate the antibody to protect the body from the virus. Our genetic material is found in the nucleus of our cell. Therefore, mRNA cannot penetrate our cell genetic material, which is our DNA. Fifth myth is the development of COVID-19 is suspicious because it has been developed too fast. Most vaccines take 4 to 6 years to develop, and this one came about within less than a year. The time frame was decreased to develop the vaccine because the government of the United States, as well as many other governments, spend significant amount of money in developing the vaccine. And the mRNA work has been studied several years before. It is not a new practice. A large number of people participated in the testing component, over 60 to 30, between 30 to 60,000 people. Some of the clinical testing were performed with some overlapping time, which helped to shorten the time frame. Scientists from all over the world collaborated toward the development of COVID-19 vaccine. They were able to move fast because China sent the coding for the virus to the scientists who were able to start the vaccine development right away. Mid-6, questioning the efficacy against mutated viruses. Coronavirus undergo many different mutations in their genetic code. For example, we currently have the UK mutation, Brazil, and the South African mutation. The current vaccine in use have been evaluated for the effectiveness against all 3 mutations, and they have found to be effective against those variants. Both Pfizer and Moderna are effective. And the last myth that I want to talk about is potential mandatory status. Conspiracy theorists have already suggested that politicians have the intention of making the vaccine mandatory. However, the principle of will or the principle of choice prevails, and it is recognized that the right of every individual is to be able to accept or refuse therapy or medical procedures. Leaders in certain countries, however, may require vaccination before entry into territory. And I want to share with you that recently it was reported to me that even in the home healthcare industry, some many of our people in our community, they are taking care of elderly people. And people now who have been, patients who have been vaccinated are now asking their home health aide, are you getting the vaccine or are you gonna get the vaccine? And recently one person was trying to get into a case, she was assigned and the patient refused. It's not the agency, but the patient refused because the patient wanted a home health aide who was already vaccinated because the patient was vaccinated. I'm just sharing most updated information with you. So the government may not say you can't do certain activity. The agency may not say you cannot have a case. However, patients can refuse, and that's their right as well.
Thank you so much. Thank you so much, Florence, for that wonderful information. It's very important for us to be able to distinguish what is true and what is false so that we can make the best and educated decisions for ourselves, especially concerning this deadly pandemic. So the next person I'm going to introduce to take us a little bit further into the conversation is Dr. Ernst Jean. Dr. Ernst Jean is an internal medicine doctor who immigrated from Haiti to the US in 1981. For the past 30 years, he has been servicing the Haitian community in his private practice while supporting coalitions and initiatives to improve the health of the Haitian community, both not only here, but also in Haiti. Dr. Ernst Jean is going to help us explore more in depth, more information about the vaccine and why it's so important for us to be able to take it. Dr. Ernst?
Good evening, I'm Dr. Ernst Jean, and I'm going to talk to you about why we need to take advantage of the vaccine. First of all, as Florence mentioned it, the disease is caused by a virus. It's not a hoax, it's real, and it kills. It's a dangerous virus. And the vaccine is one of the best tools we have to address it. Now, along with social distancing, wearing a mask, the vaccine is a key way to avoid dying from it or being crippled by it, because even folks who survive it, many folks who survive it are crippled by it. So, COVID là son virus qui cause. Li dangereux, li tue moun, li dommage moun, même l'homme moun survive. Vaccin c'est un des meilleurs outils nous gagnons pour nous combattre. N'a mette masque, n'a laver main, n'a prêté loin moun, mais c'est vaccin qui pas plus gros protection. Pour ça, pour nous vacciner, vaccin pas dangereux, vaccin bon. The vaccine is safe. The vaccine works. It's one of the best vaccines that we have in terms of the efficacy of the vaccine. It's comparable or even better than the measles vaccine that has been the gold standard. L'homme prend vaccin, il protège, même si malade ou pas malade en pile, et il fait qu'on pas mourir. En Israël, côté yo vacciner tout le monde, yo déjà ouais que côté yo fin vacciner tout le monde, non pas mourir encore de Covid là. Ensuite, nous-mêmes, nous ne pas trop malades, mais nous avons protéger le monde. Nous parlons en Haïti, pas de COVID vaccin en Haïti. Donc, il faut protéger les gens en Haïti. We are very lucky in the United States to be able to have access to the vaccine. You heard our public official talk about the access that they got for us. As of tomorrow, Medgar Evers College and your college will have the vaccine. One can walk in and one can make an appointment to go get it. We need to take advantage of it. It makes all the difference. And again, it is safe. By the time they had immunized 2 million people, only 28 folks had a serious reaction. If one has a medical condition, it's good to check with the provider to make sure that it's okay. Very few folks are not good candidates to receive it, but it's a very, very small fraction of folks who cannot receive it. But for the most part, it's a blessing to be able to have this vaccine, and there is nothing better now. Even the medication that one uses for folks who are really sick, they don't work for everybody, and too many people are dying. 500,000, more than 500,000 as of yesterday. It's time for us to go get it. Marcher pour un vaccin, marcher pour un vaccin, marcher pour un vaccin, tout côté de government, plus vite possible. Thank you.
Thank you, Dr. Jean, for that information about the COVID-19 vaccine. Like we have been saying throughout the service so far, it's very important that we are not only informed to make the best decisions, but we know what's available to us. So I know it's a lot of information that we're giving out right now, and I want to encourage and remind people that feel free to please chat in any questions, comments, and concerns that you have so that we can address them in the conversation part of this dialogue. Je voulais encourager tout le monde pour make sure nous chat, même si c'est en créole, même si c'est en anglais, n'importe langue nous gagne, pour nous poser questions dans le chat sur Facebook là, ou bien YouTube là, et puis n'a adressé ça, nous arrivons partir n'a fait conversation avec tout le monde. So the next person I'm going to introduce is Julie Livingstone. Julie has joined the Bridge Health team as the Health Education Specialist for the Health Equity Group in December of 2020. She is currently earning her Master's of Health Administration degree from Columbia University while working part-time as an advisor at Better Health Advisors. Julie?
Hi, thank you, Steffi. So as Steffi said, I am from Bridged Health, and we are a nonprofit organization with a goal of bridging the gap between information that is out there and getting it to people who might not have the access to it. And so with Bridged Health, I have started an initiative with COVID-19 vaccines, and I have created some resources that I shared with Hope, and we can present those resources right now. So the first one is this small pamphlet to just give a little bit of information. And so the first part of it is just who is currently eligible. And while this is not a complete list, it is just a good example of who is currently eligible. And in order to check your eligibility, you can go to a website that is linked down there, and it will tell you if you are eligible for the vaccine. And the next portion of that is going to be how you can find these locations and how you can register for approval. And so locating a clinic will be, the most difficult part, but we will provide you with those resources so that you can find the best place for you. And registering for approval is just a simple form where you fill out your name and a few other details about yourself. And so all of this information can be found on the HOPE website. And so this part of the pamphlet where it says scan me in the black and white, if you pull out your smartphone and you pull out the camera app and you hold it up to that little square, it will actually take you to a much more comprehensive sheet that tells you where you can get the vaccine if you're eligible, and that resource will be constantly updated. And I believe that you can find this QR code on the HOPE website. And so the next piece, this is the actual pamphlet full of information. And so the kind of information you can find on here on the first page is if you're eligible. So there's different groups. And then the most recent group that has become eligible is people with comorbidities and underlying conditions between 16 and 64. And so this just gives you a list of if you qualify. And then on the next page, it gives you a brief introduction of where you can start your search. And so the first page was just government websites, which kind of consolidates a bunch of websites to look at. And if you want to get more specific, this page gives you hospital and healthcare facilities, pharmacy vaccine sites, and the bottom part actually gives you vaccine standby and wait lists where you might not be eligible right now, but if vaccines come available because someone canceled their appointment, you can get one through that. And so this other page says it's transportation for elderly. And so this is a great resource to have. If you qualify for any of the top 3 ones, you can call them, you can go to their websites, and you can figure out how to get a ride to vaccine, because we want to make sure that people really have access to get to those vaccine appointments. And the bottom one, you don't have to be eligible for any of them. You can just call their number and set up a ride through them. And then on the last section of the next page, you will be able to find information for veterans, telephone hotlines if you have questions about that vaccine, if you want to get any clarification. As we've spoken about before during this talk, there are a lot of myths out there. And so if you need any help at all, you can call these lines. And the bottom part is linked to a bunch of Facebook groups that are actually very helpful. There's a bunch of really great people offering their assistance to help people find vaccine links, especially, it can be difficult if you don't have a translator and if you're having a difficult time navigating these websites. There are people that are willing to take down your information and make the vaccine appointments for you. So like I said before, these resources can all be found on the HOPE website, and they will be continuously updated. And at Bridged Health, we are happy to help. We are working on trying to get these resources translated, and we are working on trying to get a team together to help people make appointments.
Julie, pour ton bonne information pour nous là, pour nous joindre côté pour nous prendre vaccin, et toute information dans website HOPE là, si nous checker li, faut nous checker pour nous. Nous avons qui bon pour nous prendre vaccin et puis qui bon pour nous information pour testing pour tout l'autre bail.
Thank you, Julie, for that presentation, and thank you, Dr. Ernst-Jean. Just to reiterate what they said one more time, there is a pamphlet on the HOPE website and the Bridged Health website. On this pamphlet, there is a bunch of information like who is eligible, who can take the vaccine, where you can find transportation, if you're a veteran, and the hotlines that you can call. So please make sure to go on the HOPE website to get that information. And most importantly, there is a code that you can scan so that you can find more information specific to you and your resources around your local community. Now we are going to have a brief commercial break for the video from NYC Cares, another resource that HOPE is helping to present to our community.
In New York City, we believe everyone deserves affordable health care, no matter how much money you make or where you were born. That's why we created NYC Care. This program helps you get health care at little or no cost. NYC Care is not health insurance, so you don't have to worry about monthly payments. And it's free to join. You can join NYC Care as long as you've lived in New York City for more than 6 months, don't qualify for health insurance in New York State, and can't afford to pay for a health insurance plan. Once you join, you'll get a membership card, which allows you to visit our hospitals and neighborhood health centers across the city. You'll also get your own primary care doctor, who you can see in 2 weeks or less. Plus, you can get low-cost prescription medication with expanded hours at pharmacies nights and weekends. NYC Care also provides specialty services, such as women's and mental health, diabetes care, and cancer screenings. If you're unsure about the services we offer, a 24-hour customer service support line is available with people who speak your language. Are you ready to unlock your right to healthcare with dignity and respect? Visit our website or call us to get started today.
Dans ville New York, nous croyons que tout le monde mérite soins santé à bon marché, quelle que soit la quantité l'argent fait ou soit qu'on fait. C'est peut-être ça nous créer NYC Care. Programme ça aide aux joindre soins santé pour un petit crash-cob ou bien gratis. NYC Care par une assurance santé. Qui donc ou pas besoin d'inquiéter pour paiement chaque mois. Et puis il est gratis pour entrer là-dedans. Une fois ou entrer là-dedans, ou bien propre docteur soins généraux, médicaments à bon marché et services spécialisés. Est-ce que vous parlez pour prendre droit pour joindre soins santé dans dignité et respect? Visitez site internet nous ou bien relais nous pour qu'à commencer aujourd'hui à même.
So that was NYC Cares. Once again, Hope is offering this resource to help people enroll into this form of health insurance. If you live in the 5 boroughs, you can call us, email us, contact NYC Cares directly, or Hope to get help with enrolling into this program. We are here to help you. We care about your health and we care about our community. So to get back to this topic of COVID-19 and to further along this discussion, I'm going to be introducing Dr. Serge Pierre-Louis. So Dr. Serge Pierre is a MD and MPH graduate from medical school in Haiti, and he obtained his public health master's in public health in Chicago. So he is also a neurologist that is specialized in epilepsy. As a neurology consultant, he often evaluates patients with neurological symptoms. He volunteered over the years in several medical centers in Haiti, seeing patients and teaching local health workers. He is also the founder of the past president of the Dusab Heritage Association, a nonprofit organization dedicated to promoting the legacy of Haitian-born Jean-Baptiste Point Dusab, founder of Chicago. So obviously he's still here dedicated to his community, along with Dr. Ernst Jean, along with Florence Mark Charles. So we're gonna open up the floor for discussion. We're gonna address all the questions that you've been giving in, and we're gonna talk about COVID-19 and how we can support our community. Dr. Serge?
Yes, thank you very much. First, I'd like to thank Haitian American United for Progress for inviting me to this dialogue. I think it's very important for us in all Haitian communities abroad, and as well as in Haiti itself, we should have this kind of conversation to make sure we understand exactly what the disease is about and how we can protect ourselves and our families from the disease. So I'd like to congratulate HAUP for putting together this kind of bâtonnel conversation. The second thing is that I'd like to point out that we are still learning a lot about this disease and about the vaccines and all that. And I think it's okay for people to have their fears and to be reluctant, as long as they are prepared to talk about it and seek more information and then make a decision. And that's what we are here for. And after we give all the advices tonight, make sure that as you make your decision, you have a discussion with your private physician. That should be the final step before you go ahead. The third thing I'd like to say is that I am so happy to be here today. And if I say anything that is not correct, don't blame me, but go ahead and blame Dr. Ernst Jean, because everything I have learned in internal medicine when I was back in training in Haiti, I learned from Dr. Ernst Jean. So that is his fault if I say anything that is bad tonight. Just call him and blame him. Having said that, I am happy to be here with Florence Mark-Charles, the other panelists, and I'm happy to answer any questions that the audience may have.
So I'm going to get us started with our first questions. Dr. Jean, did you want to say something?
No, it's so good to have Dr. Pierre-Louis. And it shows the commitment, the long-term commitment that our generation has had with our community. And it's a blessing to have Dr. Pierre. It's a real pleasure for all of us.
Thank you.
Thank you. And
So to get us started, I'm gonna introduce the topic of why did you choose to be vaccinated? For the people watching, I think it's very important to understand that not only are we presenting this information to you, but we believe in what we're presenting. So our panelists here not only are presenting based on their professional experience, but also on their personal experience. So I open this question up to everybody. Why did you choose to get vaccinated?
I've been hit by this disease very early. I lost friends. I lost my wife. I lost coworkers. I know it's real. I know it's real. I did my homework to make sure that the vaccine was safe. I've been dealing with folks who are positive. I'm still dealing with folks who are positive on a daily basis. And I had not been able to work that much for the past year because I would have exposed folks at least in one of the settings where I work, which is a small office. I would have exposed the other workers at the office had I been bringing the number of folks that I usually see. So it's been a very slow operation for the past year. And I just received my 2 doses of vaccines. I'm protected now. The rest of the staff at the office is protected. It's only now that we can start again serving the community the way we would like to, because we were at risk also. We've been at risk. We are still at risk. In addition to the vaccine, we wear our mask. We practice social distancing as much as one can, the setting that we were at. But the vaccine is one of the few options we have now. The medication, the treatment does not work for everybody. There is a high risk once one has a severe form of the disease. And for the time being, for us and for those we care about, the vaccine is the best bet. And the technology behind the vaccine has been around for over 20 years. It's not like it's a new vaccine. What is new about this vaccine is the way over the last few years that they've been able to wrap it inside a particular greasy molecule to be able to get it where they wanted to get it into the body. They have tried this type of mRNA path with other viruses, but it succeeded with COVID. So it's not really new and it's safe.
Dr. Pierre-Louis,
Thank you, Dr. Jean.
Yes, thank you. I completely agree with what Dr. Jean just said. I would add that it is important to understand that when we are dealing with a pandemic, when there is a disease, a virus that is all over the world, our options are very limited. On one hand, viruses don't respond very well to regular treatment. So it's not a bacteria that you can use an antibiotics and then you get rid of it. Viruses are much more resistant to treatment. So the best way to protect ourselves is to be vaccinated against the virus. And once we understand that, then I think what we need to do is get the information about the disease, about the virus itself, about the vaccines, and then do our job in society, and which is to actually be part of the solution. And that's almost the only option that we have. So if we are fortunate to be in a place where there are vaccines available, where they've been studied thoroughly, where they have good efficacy with limited side effects, well, then this is the best of all worlds, and we should take advantage of that. Finally, the last point I'd like to make is that there aren't many ways to stop the pandemic. It's not that we have that many options. If we don't vaccinate ourselves, then the virus will continue to spread from person to person, And the longer we allow the virus to do that, the more chances the virus will have. Every time it multiplies, well, it can change into something else. And it can become a mutant virus, which is much more lethal, that can kill many more people, and that may be more difficult to contain. So when there is a new virus and there is a pandemic, we have to quickly bring that virus under control so that it doesn't spread and keep mutating. And the only way to do that is to vaccinate as many people as quickly as possible so we can get rid of the virus.
On my side, why I decided to get vaccinated is because I've been following how difficult it has been in the past year, being confined and watching TV, listening to the governors, sharing with us how many deaths every day and how many people in the hospital every day, and how difficult it's been for family and friends. I've had neighbors who have passed away. I have friends who have passed away. I have church members who have passed away. I have 2 members of my gym who I just heard who passed away from COVID. This is real. And I have suffered from all those losses. And I've tried to follow the science, listening to what the latest about the latest finding about the virus. And as a result, I saw that unless most of us get vaccinated, including me, then we are not going to get out of this big pandemic. Therefore, a month ago, the 4th of February, I decided I'm going to go for my vaccine. So I took my first dose, and I will be vaccinated for my second dose on Thursday. And I've been encouraging friends and families and my neighbors to do so, because I realized unless we get what they call herd immunity, many people get vaccinated so that the virus does not continue to spread all over and mutate and cause more damage. So I think we, as members of society, I feel very strongly that we have our part to play to not only protect ourselves, if this is a tool that is available, but protect our family, protect our village, protect our city, and protect the world. So we need to understand that we have a part to play in this. And that's why I decided to take the vaccine. And I've had no side effect from my first dose.
I'm glad to hear that, Florence. Thank you so much. I think you touched upon something very important, because for the people watching, these are medical professionals, these are health professionals. They are well versed in the science and the medicine in the realm of public health, but also this is personal for them. This is a story about them being members of society, like you said. It's more than just the medicine, it's the aspect of people are dying and this is real and people are hurting. And so we need to protect ourselves and make the best choices to protect ourselves. Thank you so much for sharing your stories. I'm going to bring us to a next topic, which is touching on some information that was shared earlier. We know that there are 2 companies producing the vaccine. There's Pfizer and Moderna. So people may be confused between the 2, and some people are questioning which of these vaccines is better.
So far, both have been good. They've delivered what they promised. They've been safe as one as safe as the other also. The difference with them is the logistics. For the Pfizer, it's more difficult to keep the Pfizer at the temperatures that it needs to remain stable. The Moderna is a little bit easier to handle. So the Moderna will go to smaller clinics, to smaller places where the where it will be easier to handle than the Pfizer. The Pfizer requires large freezers, and the lifespan of the Pfizer once it's open is a little bit shorter also than the Moderna. But both of them are good, and we don't always have the luxury to know which one we are going to get. Either one is as good as another.
Dr. Pierre-Louis?
Yes, I agree with that. The two vaccines that we have available here, they are both made about the same way and the same technology. And then they are about 95% efficacy, which is excellent. We have to remember that the regular flu vaccine that we take every year, it's about 50% efficacy. So that's why some people say, well, moi même pas j'aime prendre à faire flu vaccine ça parce que même l'aime prendre, m'gain flu quand même. Well, that's because there are several strains of the flu virus every year, and then the vaccine that we have covers about 50% of what's available there. So when we have two vaccines that are 95% efficacy, this is rare, and that's something we should celebrate. There are other vaccines that are coming. Now, between those two, by the way, so it doesn't matter which one you take, you'll do just fine. It's just that the Pfizer vaccine is more difficult to handle because of the type of refrigeration that is needed. And in certain countries, it's going to be difficult to handle a vaccine like this because they don't have the equipment to store it and to freeze it to that degree. So there are other vaccines that are going to be coming out. The Johnson vaccine, they are in the process of trying to apply so that within the next month, we may have a third vaccine. This one might be easier to handle. It might have only one dose that is needed, and it can stay at room temperature. So that kind of detail is going to be important. Now, it does not have 95% efficacy. The efficacy is about 60%. But then again, if you look at the fact that it's going to protect you against death and severe disease, well, that is still a good vaccine. The AstraZeneca that is in England, it's about 70% efficacy, which again is good. The Russian vaccine, the Sputnik 5, they claim that they have over 90% efficacy, even though the experience in Brazil, they feel that it's actually closer to maybe 60, 70% efficacy. And then the Chinese vaccine, the Sinovac, also they are claiming anywhere between 70 and 90%. We're gonna have to see once they start using it, what the actual efficacy is. So in summary, all of those vaccines, they are good. They're gonna help us create what was mentioned earlier, what is the herd immunity. Once you have enough people, about 85% people vaccinated, then the rest will be protected, whether they are vaccinated or not. And I think this is gonna happen regardless of which one of those vaccines that you decide to take.
So I just want to highlight, as we heard from the two doctors, Dr. Jean and Dr. Pierre-Louis, when they're talking about the difficulty, they're talking about the hospital's responsibilities of keeping it in room temperature, of keeping it or at elevated temperatures, or keeping it safe and secure for people to be able to take the vaccine. They're not talking about the vaccine and the person, just the hospital's responsibility to be able to take the vaccine. But as they both said, it is something that is very applicable, right? 95% rate of success. And so these are things that makes both of them safe, both Pfizer, both Moderna. And again, as we mentioned before, and I think Florence can speak to this, we don't know which vaccine is necessarily present at the site that you're going, but they're both available and they're both okay to take.
I can speak to that because I had two experiences. The first experience was when I went to get my first dose, and when I arrived, I asked what vaccine would I be taking, and they say, we have the Pfizer. So that's what I took. I didn't have a choice. And as a public health nurse, I had volunteered to give vaccination. And when I went to the site, and only after we were all set up to do the vaccination, that we were told, oh, today is Moderna. So I gave Moderna vaccine. So you don't know until you get to the place.
Right. Well, the only thing I would add to that is that it is better to stay with the same vaccine. If you get the first dose with Pfizer or Moderna, make sure that the second dose is from the same manufacturer, because we don't have enough information yet to know whether if you kind of crisscross, if you take one vaccine the first time and then the other vaccine the second time, whether you're gonna have the proper immunity and what the reaction of your body might be. So the official recommendation as of now is to stick to one vaccine and get both doses from that same manufacturer.
Well, when they give you the appointment for your second dose, it is written on your card what vaccine you took, and they will only schedule you. If you took Pfizer, they will schedule you for Pfizer. If you took Moderna, they will only schedule you for Moderna for your second dose. So that's very important.
Thank you for touching on that. One question. I'm sorry, Dr. Jean.
It's important to schedule the first one. One secures the first one. The place where one goes will make sure that one gets the second one.
Yeah.
Right.
Thank you. One question that we have from the audience is, will we have to take a booster shot every year? So is this something that we know for now?
We don't know yet. Because this is a completely new virus, it's a new disease, and those are new vaccines. So we're gonna have to see, once your body produces the antibodies after you receive the vaccine, we're gonna need to know how long the antibodies stay there and at what level. So the only thing we can say so far with our experience, it looks like 90 days, so 3 months, we are comfortable saying that if you get vaccinated today, you are protected for the next 3 months. So by the fall, as we keep monitoring the people who are vaccinated, we'll have a better idea after 6 months, 9 months, and 12 months, whether we are still fully protected. Are we still talking about 95% protection, or has it dropped so low that we are not meaningfully protected any longer? If this is the case, we might find ourselves in the same situation that we are with the flu, which is that every year we need a booster, we need to take, to repeat the vaccine. We just don't know yet. The second thing we don't know either is whether the virus, once we get herd immunity, and we are hoping that's gonna happen within the next 6 to 12 months, if we can vaccinate most of the population, we don't know how many variants are gonna be lurking around, and that may require that we get revaccinated if those variants don't respond as well to the initial vaccination.
Also, we may have a collective responsibility. Those of us who have worked with HIV virus know that the replication encourages the mutations. The previous COVID, the previous SARS and MERS outbreaks were controlled a lot faster. We are having a pandemic now, and it's so much multiplication. The more folks are getting sick, the more the virus is multiplying, the more challenging it's going to be to have something that will be able to deal with all of the mutation that one may have. The sooner one addresses it, the more folks, the more we limit it, the least chances the virus will have to become a little bit more difficult to face in the future. We unfortunately it will be on containment now, so we'll see what it turns out to be. Yeah. But the way they do for the flu, as Dr. Pellu might have alluded to, is one may need to get a booster periodically if one loses the benefits of the protection given the new variants that may emerge in the future.
Thank you. So as we're on the topic of immunity that Florence brought up earlier as well, and Dr. Pierre-Louis and Dr. Jean just mentioned, for people who have already had COVID-19 or been exposed to it, should they still take the vaccine?
Yes. So if you have COVID, let's say today, your body is gonna build up some degree of immunity against it. But we don't know how much immunity you're gonna develop, what's gonna be the level. And secondly, we don't know how long you're gonna be protected. So again, the official recommendation is for you to wait. Don't do it right after you are still symptomatic. So you're gonna give yourself time. And then once you become convalescent, the official recommendation is still for you to go ahead and be vaccinated so then you can have the full protection.
I think we're all in agreement. Yes, we should take the vaccine.
Yeah, we should take the vaccine. Yeah.
So one of the groups of people that also have concerns about COVID are pregnant women. Personally, I work in maternal infant health, so I'd like to be able to give more information to my clients as well, right? Is the COVID-19 vaccine safe if you are pregnant?
The recommendation is that one discusses with the obstetrician.
Okay.
And the reality is that 13 to 50% of pregnant women tested at Colombia were positive, and the symptoms of COVID may mimic the symptoms of some symptoms of pregnancy: the fatigue, the shortness of breath upon exertion at the end. They tested many women who knew they were pregnant, who were feeling pregnant, but didn't think they were sick. And 13 to 15% of them turned out to be pregnant. And now they are testing all pregnant women before they get admitted for delivery, because there have been some outbreaks in some nursery early on before we knew that many pregnant women carry the virus, and they don't know it.
Right. What I would add to that is, I know the CDC has been struggling with that question, and the latest recommendation that they made was that they think it is safe. And what they say is that women who are pregnant and who wish to be vaccinated, they may get the vaccine. So they are not pushing pregnant women to go and get vaccinated, but if they want to be vaccinated after they have a conversation with their private physician, then the CDC and the scientists would not have any objection to that. And the point that they are making is that being pregnant puts you at high risk pregnancy. And it's like having diabetes or hypertension. Your course of the disease might be more severe because you are pregnant. Therefore, you have to balance things out. Do you want to take your chances and say, I'm not gonna be vaccinated? Well, then you may have a more severe COVID illness with whatever complications that there may be for the mother and the child. Or would you prefer to say, well, based on the evidence we have so far, it seems to be safe, so I'd rather protect myself during the rest of the pregnancy. I protect myself and my baby, and that decision would be fine as well. During the trials that Pfizer and Moderna did, a number of the people, the volunteers, among the 30 to 40,000 people that they use for their clinical trials, some of them actually turned out to be pregnant. So they have actually a cohort of people who were vaccinated, who did receive the vaccine, not the placebo, but the actual vaccine, and they got pregnant. So they are actually following those people now to see whether they have developed any problem after they got the real vaccine while they were pregnant.
Also, pregnancy is the postpartum after delivery. The chance of having blood clots can be high when one has been in bed for a few days. And we know right now that COVID is a thrombotic disease.
That's right.
And it's the two of them might be a bad combination.
Mm-hmm.
Right. Thank you, Dr. Jean, Dr. Serge Pilly. The next question I have is for another vulnerable population that Hope is dedicated to serving, and that is the undocumented people. So for people who don't have their papers, they want to know, can they still get the vaccine?
I can answer for Chicago, and the answer is yes. In Chicago, it doesn't matter who you are, where you are from, you can get the vaccine. And from a medical standpoint, we have to understand that when in a society there is a virus that is running around, it would not make much sense from a policy standpoint to be excluding certain groups, because then you are defeating the purpose. The whole purpose is to vaccinate the entire population, or at least a significant majority, so that you create herd immunity. If you start excluding people for political reasons, you may never get control of that virus.
I believe in New York, there is no such requirement that you must provide documentation that you're legal, and all that you have to do is to show something that where you live. For example, the new sites that have opened up, they are for some particular zip code because they want to give priority to certain areas that have been underserved. So if someone has anything that will show where they live, then they don't need any immigration paper. They don't need to show that they are citizen or permanent resident. It is there. And when I went to register at the vaccine site, none of that was asked. Okay, so people can go without fear that their immigration status would not be revealed.
And that goes for vaccine and also for testing.
Yeah, both.
Right.
Okay. So as health professionals have said, everybody, you can go get vaccinated if you're undocumented. That should not stop you. As Dr. Pierre-Louis has mentioned, the public health initiative to be able to protect the public, right? And so we don't have time to be diversing in politics and excluding people and jeopardizing the health of the nation, right? So another question that we had that came up was about the access to medical care. Do you guys think that it has been curtailed because of COVID-19?
Ernst?
I'll let Serge go first for his experience.
Yes, well, it's been kind of interesting to watch what's happening in the medical community over the past 12 months. And initially, when the pandemic started a year ago, and we didn't quite understand the disease, there was no vaccine available, there was no treatment. Well, a lot of people decided to stay away from the emergency room when they had a stroke, for example, or they were having more seizures, and they decided not to come. They were afraid of going to the emergency room so that they don't contract the coronavirus. So we went through that phase, I think, and for a good 3 months into the summer, until we started having more information about the virus, and we started reopening some of the non-COVID related medical care that we were providing, and people started showing up again little by little and getting their routine care. So that has changed over time in the last 12 months. The second aspect of this question is, remember that a year ago when the pandemic started, the hospitals, they were overwhelmed by the number of people presenting to intensive care units and emergency rooms. So the hospitals themselves also made the decision not to do non-emergent care. So all routine surgeries, for example, they were postponed. And so the answer is yes. I think regular care, medical care, has been influenced by the disease in the last 12 months. We are at a place now that we are more in control of how to manage COVID patients while we are providing regular care and doing non-urgent surgery. So we are in a much better place now, I would say.
The damage, though, has been done because many folks will stay away from an emergency room with some dangerous conditions, being afraid of contacting the virus in the emergency room. And even for preventive care, folks will not go for mammography, colonoscopy that would have been scheduled. We are postponing things. For a while, there were not many eye consultations happening. So glaucoma, all kind of things are getting out of control. And when it's come to doing a procedure to this day, most of my friends now will test you for the COVID before they consider doing a procedure. So these are additional steps that may be some kind of a barrier to access to care and make it a little bit more costly also. And there will have to be a re-education. We'll have to resume educating folks about preventive care and everything because everybody's a little bit lax now. In addition, I believe that many cases at the beginning, many cases have not been reported because somebody would be dying of a heart attack last year between March and July, March and October. Even if it would be the medical examiner's case, the medical examiner would not be doing autopsies because they were so overwhelmed. So, and they were not doing any testing for COVID, even when they were asked. I lost a good cook to who didn't have that many medical conditions. And I asked them to test to see because there was a large family and everything. They were not testing for COVID. So the statistic that we may have may be underreporting the impact that COVID has had all along.
But it sounds like Dr. Jean is making a strong case for the vaccine because everything he just said there, that's precisely why people should get vaccinated. Then you don't have to worry about having your colonoscopy, your mammography, and all the routine care that we all need. If we are all vaccinated, there is no problem. So you just made a very good case, Dr. Jean, for the vaccine.
I would agree to that.
I agree as well. Thank you all.
We need it.
So one last question that people have is, and I think this is one of the most important questions, where can you get help?
At Hope, the website, right?
Yes, ding, 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 ding. Yes.
Hope is there to
So I
help.
would like to remind everybody, exactly, Hope is there to help. Hope is there to give hope to the community. If we cannot give you any resources, the one thing we can give you is information to find resources. So please, if you're watching, please visit our website to find the Bridge Health pamphlet that has been that can be helped to find the resources in your community. Please visit our website to see all the other services that we can provide to our community that if you may need help. And lastly, please visit our website to donate to us to keep having these conversations, for us to be able to provide and serve our community the way we've been doing for the past 45 years. It's very important for us to keep going. We have offices in Brooklyn and Queens. Our website has many resources that you can see in the programs that we've been doing throughout the COVID pandemic and through how we've been supporting the individuals and especially the Haitian community. So I'm gonna say it in Creole, right? So everybody can get it. Visite website là. Allez sou site là, al gade ki jan nou ka edo, al gade ki kontak informasyon ki gen pou ka rele nou, ekri nou, text ou n'importe sa vle fè. Gade ki jon ka donate, right? Pou bay, pou n'ka kontinue pou bay servis nan komunite, pou n'ka kontinue bay informasyon sou platform nan konsa, pou n'ka eduke pep nou, et puis pou n'ka toujou provide support. Hope is here to help. I think that's going to be a quote. Florence said it best. Hope is here to help. Thank you all so much for taking the time to have this very important conversation with us. I'm gonna let Florence explain this last slide because it's just showing that we talk the talk and we walk the walk.
Okay, here is the site of some of us who went to be vaccinated, and we really were happy. It was a happy event. It was not a scary event. We were happy. It didn't hurt. We got vaccinated and we were happy. And I must say that when I volunteered to vaccinate, this was a happy event because everyone who came to get their vaccine, either the first dose or the second dose, they were all smiling. They felt a lot of express their gratitude because they know they were getting something to protect themselves, protect their family, and protect the community. So please get vaccinated. It is the right thing to do for yourself, for your children, for your parents, and for the community. That's my message. Get vaccinated.
Thank you, Florence. So once again, I would like to thank everybody for participating, all the questions that came in, all the viewers. I would like to thank our panelists, Ms. Florence Mark-Charles, Dr. Serge Pierre-Louis, and Dr. Ernst Jean. Thank you to Julie Livingston from Bridge Health for providing us with that pamphlet. Again, resources that you can find on the Hope website, as well as the Bridge Health website. Thank you to Melinda Placide, our producer. Good night and good evening to everybody. Don't forget to visit us. Don't forget to get information, and don't forget to contact Hope. Thank you very much.
And thank you, Stephanie.
Thank you.